2, 3. Good job. Good job.
The goal is to prevent millions of people from getting vaccine-preventable diseases by the year 2020.
Can you take a deep breath?
No.
No? Okay.
The plan is to provide universal access to vaccines to protect people of all ages, from the very young to the very old. The World Health Organization wants people everywhere to know that vaccines work.
First, to say that immunization and vaccines are the most powerful public health tool that we have.
Dr. Flavia Bustreo says 35 years ago, 13 million children lost their lives from diseases that could be prevented by vaccines. That number has been reduced to 6 million, but that's still too many. Today, 85% of children are vaccinated against measles and other deadly diseases, but that number has to get even higher.
We need in a population to have a vaccination coverage that is above 90% in order to have what we call the herd effect, the herd immunity, which means that you cover the children that are vaccinated, but also because of the reduction of transmission of the infections, you also cover the children that are not vaccinated.
6 years ago, 194 countries signed on to the Global Vaccine Action Plan to boost those numbers and to end polio. Right now, there's a special urgency to get all children vaccinated against polio. In most countries, it's a disease of the past. Polio only exists in 2 conflict zones, in northern Nigeria and along the border between Pakistan and Afghanistan. Last year, there were only 37 cases, compared to the 350,000 cases in 1988, when the eradication campaign began.
The last part of eradicating any disease is always the hardest part. If you don't do it, you lose everything. To do it, you've got to really bring all the energy and commitment that you can to bear, and it requires a special kind of dedication.
The UN plan also calls for controlling all vaccine-preventable diseases and to be well on the way in developing new vaccines for other diseases that plague our world by 2020. Carol Pearson, VOA News, Washington.